Hello everyone, welcome back, and this is Dan GH. My name is Anita, and today we will be talking about the clinical link station under the midwifery Osce. If you have been watching my previous videos, you realize that we started with the assessment station, the planning, implementation, and how to fill the meals chart. Today we are going to talk about the link station, and 3 skills goes under the link station. So stay tuned and go nowhere. Yes, so welcome back. As I mentioned earlier on, this particular station requires 2 skills. However, there are 3 skills that goes on into this. We have the birth, we have the newborn examination, and the postnatal examination. So you are required to do either birth or postnatal examination, birth or newborn examination, or postnatal and newborn examination. It is required of you to use 30 minutes to complete this particular station. So when you are given the 30 minutes, you are allowed to do the 2 skills all together, including documentation of both skills. I hope this perfectly makes sense. So you are not given 30 minutes just for one particular examination, could be birth, postnatal, or newborn examination. No, you are given 30 minutes to complete 2 skills together. So you can either do both examination all in one and do your documentation of the 2 at the latter bit, or you can do one document and do the other and document as well. So we're going to start with the birth. We move on to the newborn examination and the postnatal examination. Starting with the birth, there are 9 marking criteria they are going to look out for, making sure that you are showing all these in your process. We start with washing your hands. However, you should also know that birth is, you are going to use a dummy. So it's going to be a pregnant dummy with a baby in the vertex presentation. You are not going to have a real person who is going to deliver baby. So with the dummy will already be positioned on the bed for you. Your examiner is going to assist you. However, your examiner is not going to take part of the examination, but she will be there to assist you in whichever way you want her to be. So for example, if you want her to push the baby down as you are helping with the delivery of the baby, she will do that, but she will not take part of the examination. Let's keep that in mind. So with this particular link station, both station requires that you perform your PP, you wear your PPEs, you wear your PPEs, and that is wearing your gloves and your apron and performing your hand hygiene. Never forget, before approaching the patient, perform hand washing, wear your apron and your gloves, then approach the situation. When you approach the situation, you are supposed to calm the person into a comfortable position. So performing your hand hygiene, never forget you need to verbalize everything you are doing. So just imagine that dummy on the bed is a human being. How are you going to approach this patient's labor process? The next point is for you to encourage and support this woman with each contraction and inform her that when the baby's head is visible, you are going to communicate that to her. That is your second point. Now, this particular point, you need to voice it out to the dummy. So you will tell her that I'm going to support you, I'm going to need you to push with each contraction, and when baby's head is out, I will inform you. Or if baby's head is visible, I will communicate it to you. The third marking point they are going to mark you on is you need to facilitate the birth of the baby using either a hands-on technique or a hands-off technique. Either which, you are going to choose one during the day. If you want a hands-on technique, I will always go for a hands-on technique. Why is it so? Because with a hands-on technique, you inform the mother that you are going to support the perineum, and that gives you a plus in your Osce. So always, you can either go for a hands-off, but tell the woman that you are ready and you are awaiting baby to push it out. You are waiting mother to push out the baby. However, if you go for a hands-on technique, you inform mother that I am going to support your perineum and support the baby's head whilst baby is flexing out, or support the baby in a flexion. This also gives you a plus in your third point. Under your third point again, whilst you are supporting whilst you are supporting mom's perineum and baby is coming out, you inform mother that you are going to deliver baby onto her abdomen to start skin to skin. The fourth point is right after baby is delivered onto mother, you immediately dry baby with dry towel, put baby on mom, cover with a new dry towel, and within a 1 minute, you are going to administer 10 units oxytocin. With this drug administration, it is not by force you are going to administer this drug. It could be that you need to verbalize it out that, okay, mother, I am going to administer 10 units oxytocin to help with the separation of the placenta. If you do not voice this out, you are going to fail your Osce. Always voice out that you are going to administer 10 units oxytocin in order to separate placenta from the mother. This helps you gain consent from the mother. So with the fifth point, your fifth marking point, you need to inform the mother. You can verbalize this out that you are performing delayed cord clamping and cutting. This is done within 1 to 5 minutes. So you clamp the cord and you cut it. So you have to verbalize this out that you are going to delay cord clamping and cutting from 1 to 5 minutes. The 1 to 5 minutes is very important. If you make a mistake with this particular number, it can cause you to fail. So always make sure that you are saying that you are going to defer and delay cord clamp for 1 to 5 minutes. So if between 1 to 5 minutes, if the cord has stopped pulsating, I am going to clamp and cut the cord. So for me, I will always that I am going to clamp and cut the cord after the cord has stopped pulsating within 1 to 5 minutes. The sixth point is recognizing signs of placenta separation. How do you recognize signs of placenta separation? You need to verbalize to the examiner that you are looking out for lengthening of the cord and a gush of blood per vaginum. You need to verbalize this out to the examiner in order for the examiner to know that yes, indeed, you know what you are looking out for when you are going to deliver a placenta. You need to also inform the examiner that I'm going to deliver the placenta using a control cord traction method, and this is how I will do it. I am going to use a gentle traction on the cord and guard the uterus just above the symphysis pubis until placenta is completely delivered. Never forget this point. I make sure that I digest everything under control cord traction, third stage, and signs of placenta separation. If you verbalize these things in your point, you are assured that you are going to get your full mark. We go to the seventh marking point. That is examining the placenta. You need to examine the placenta by verbalizing it out, saying that you are looking out for the 3 vessels, 1 being the vein, 2 being the arteries. You are also going to check for the completeness of the membranes, the lobes of the placenta, and making sure that there is completeness all around and no retained product. After you have examined your placenta, you need to go back to the woman. Inform the woman with consent that you would like to access the vagina, access the perineum, access the soft tissues to make sure that the perineum is intact and there is no tear. You need to seek consent. If mother allows you, then you approach the mother. However, as I said, this is a mannequin, so you can't verbalize all these things out, but you need to make sure that you are saying everything of how you would have done it practically if it was a real human being. So you verbalize that, hello, Madam Juliana, I would like to access your perineum, your vagina, and the soft tissues to ensure that there is no tear, or if there is a tear, I will suture accordingly. You also need to check for PV loss, that's vaginal loss, what we usually call estimated blood loss. You need to check for that, and also clean mother, provide dignity, and secure the perineum with a sanitary pad for more hygiene, and also to contain the rest of the blood that will come out after baby has been born. The final marking point, which is so important, is you need to verbalize that you are going to perform maternal observation. What goes into maternal observation? If you remember in our assessment stage, we did say that the temperature, blood pressure, the pulse, oxygen saturation. You are also going to check the lochia, that is the blood loss coming on the sanitary pad, and also assess the uterus to make sure the uterus is firm and contraction is taking place. This is what goes into your birth scenario. So after you are done with all these procedures, you thank the woman, you cover the woman, you dispose your PPEs in the clinical waste, repeat your hand hygiene again, perform whatever documentation that may be given to you in this particular station, and move on to the next station. Thank you. I hope you enjoyed the birth scenario. We are going to move on in the postnatal examination in our next video.